everyone. This is Dr. Mansi from Homeopathy 360, and I welcome you all. We are back again on the another session of Homeo Talks 2025 webinar series in collaboration with Parul University. I'm very happy to say that today we have Dr. Anup Kumar sir from Rajkot Medical College, and we are back again with another informational webinar session. A very warm welcome to you, sir. And now, I would like to hand over the mic to Prachi to please start with the introduction of Dr. Anup Das, sir.
Thank you, Dr. Mansi. So, good evening to everyone once again. On tonight's session with Homeo Talks 2025, our today's topic is protein energy malnutrition and its prevention. It's my pleasure to introduce our tonight's speaker, who is Dr. Anup Kumar Das. He's professor and HOD in Department of Community Medicine at Rajkot Homoeopathic Medical College under Parul University, Vadodara, Gujarat. Sir, thank you very much for giving your valuable time for this webinar. Now, I would like to hand over it to you. Sir, can you please start on with our tonight's session?
Thank you, Dr. Prachi and Dr. Mansi and Prachi. Good evening to everyone. I am Dr. Anup Kumar Das, Professor at HOD, Department of Community Medicine. I am honored to be speaking with you. Hello.
So you're audible, sir.
Am I audible?
Yes, sir.
Okay, thank you. Speaking with you all today on protein energy malnutrition and its prevention. I'd like to start by thanking the management of Homeopathy 360, as well as management of Parul University, President Sir Dr. Devanshu Patel sir, Vice President Dr. Parul Patel ma'am, Vice President Dr. Komal Patel ma'am, and Vice President Dr. Gitika Madan Patel ma'am, and our beloved Principal Dr. Hitat Mehta sir, Rajkot Homoeopathic Medical College, for inviting me to share my insights with you. As through this presentation, I will be discussing regarding protein energy malnutrition and its prevention. We will examine the latest development challenges and opportunities in how protein energy malnutrition and how it can be prevented. So before this, I am sharing my screen. I am discussing regarding protein energy malnutrition and its prevention. What is protein energy malnutrition? Protein energy malnutrition is a broad spectrum of nutritional deficiencies caused by inadequate intake of protein and calories, leading to growth retardation, muscle wasting, and increased susceptibility to infection. Before discussing protein energy malnutrition, it is very important to know only those who are poor people, who is having no capacity, not capable to take adequate amount of protein regularly, only they will suffer. That doesn't mean. It means those who are not taking due to their ignorance, bad lifestyle, if their inadequate intake of protein, so they may suffer from protein energy malnutrition. And especially what happens in protein energy malnutrition, to growth, what is most important, that is growth retardation and muscle wasting. And as because there is the protein deficiency, severe type of protein deficiency, there is every possibility to increase susceptibility to infections. So those who are suffering from protein energy malnutrition, they are mostly suffering from a different kind of infectious diseases. So it is very important to know. Next, significance in public health. What is the significance in public health? Why we should discuss regarding protein energy malnutrition? As because it is a worldwide problem, it affects millions of children worldwide, especially in developing countries. Strongly associated with poverty, food insecurities, and infections. and a major cause of child morbidity and mortality. It is found that most of the African country and different developing countries in this earth, their children mostly suffering from protein energy malnutrition. Protein energy malnutrition, and it is mostly associated with poverty. Those who are not capable to have regular their foods, and different so many people are there, and especially in developing countries and also developed countries also, including developed countries, there are so many poor people are there who is not capable to give or feed to their kids sufficient quantity of food, and so many countries are there where supply of sufficient protein is not available. So there may be some food insecurities, and it's mostly infection cases, and a major cause of child morbidity and morbidity. Most of the mortality rate among child still now, even in India also, protein energy malnutrition is playing a major role. And as because the children are suffering from protein energy malnutrition, easily they are suffering from different kind of infectious diseases as well as so many diseases. And they becomes ill, and sometimes it causes mortality, increases mortality rate and morbidity rate of among children. It's a global challenge, and a global challenge of protein energy malnutrition. There are so many countries out there where sufficient food substances production is not there, and different types of food substances are not available. It may be non-production, and it may be due to poverty, BPL, that means below poverty level, where people are there living more. So they are throughout the world, it's a great challenge for us. So we will discuss regarding epidemiology. As per latest data, global burden as per WHO, World Health Organization, 2023, 45 million children under 5 suffer from wasting. Wasting means because it is the muscle wasting diseases, protein energy malnutrition. All of us, we know what's the functions of protein. It builds muscles. So if there is less supply of protein, so there may be wasting, muscle wasting. So throughout the world, 45 million children under 5 suffer from wasting, and 149 million children are stunted. That means growth is retarded. They are not healthy. They are easily suffering from different kinds of diseases. And 45% of children deaths are linked to undernutrition. It is very important, and still now throughout the world, if it is 45% of child deaths are linked to undernutrition, so it is not good for our healthy world. So in India, it was a global burden. In India, specific data as per 2020-21, wasting, that means low weight for height, in comparison with height, it is 19.3%. Stunting, low height for age, 35.5%. And underweight, that means low weight for age, it is 32.1%. It is very dangerous statistics for our Indian people. And as because there are so many people are there, they are not getting, they are not feeding not capable to feed their kids sufficient quantity of protein. And there are so many factors playing a role behind it. So many communities are there, they are not taking each type of proteins. And so many areas are there due to their ignorance, due to their incapability of sufficient financial condition. They are not giving their feed, and they are not giving their food, sufficient food, proteins to their kids. So this is why it is very dangerous for our India. That means and highest prevalence If you go through the statistical data in India, it is more in Bihar, Jharkhand, and Madhya Pradesh. Most of the maximum, that doesn't mean other states are not suffering from this kind of problem. They are also facing this problem. Their government is also facing this problem, and physicians, with the physicians, they are also facing this problem. But highest prevalence rate, it is in Bihar, Jharkhand, and Madhya Pradesh. Types of protein energy malnutrition. All of us, marasmus, kwashiorkor, and marasmic kwashiorkor. Three types of protein energy malnutrition are there. And marasmus, it is severe energy deficiency. And followed by severe wasting, no edema. How we can understand whether a child is or is marasmatic or not? That means severe wasting will be there, no edema. In case of marasmus, no edema is there. Muscle and fat loss. It is very prominent prominent bones. You can see easily all ribs. You can see muscle wasting will be there. Fat loss will be there. And child appears alert but irritable in case of marasmatic children. In case of kwashiorkor problem, we must remember that in case of marasmus, there will be energy deficiency. But in case of kwashiorkor, there will be protein deficiency and followed by edema. Edema means edema swelling in legs and feet. If we observe that we can get edema and swelling in legs and feet, fatty liver will be there, enlarged abdomen will be there, skin changes, that means depigmentation, color will be changed, color will be fade. So skin changes will be there, dermatitis will be there, and child is apathetic and irritable and weak. It is a special character of kwashiorkor children that they will suffer from. They will be apathetic and irritable. Easily will be irritable and very much weak, as because there is protein deficiency. So difference of marasmatic children and kwashiorkor children, it is marasmatic means it is from energy deficiency and kwashiorkor it is from protein deficiency. And marasmic kwashiorkor, that means combined both higher energy and protein, both deficiency will be there, and followed by severe wasting plus edema, higher risk of infections and mortality. As because there is severe protein deficiency, mostly they will be highly higher. They will suffer from high risk of infections and as well as mortality. So next we will discuss regarding cause and risk factors of protein energy malnutrition. Number one is socioeconomic causes. Poverty, lack of access of nutritious food, large family size, inadequate maternal care. And still now in India and especially in developing countries and our neighboring countries, still now proper antenatal care is not available. And if antenatal care is available there, so due to ignorance, they are not availing this antenatal care. So there are so many causes: maternal care, antenatal care, postnatal care, neonatal care. So there is so many causes. It affects especially in socio-economic conditions. Those who are illiterate, those who are poor, those who are not having financial capacity. So lack of access of nutrition of food. It is not only always due to poverty, but also sometimes ignorance plays a great important role. And in case of a large family size, what happens? All of children's, their family members or their parents are not able to provide sufficient quantity of food in case of large family size. And inadequate maternal care, it is one of the important socio-economic causes. We can remove it if we can take care about it properly, and especially if government thinks that they can remove this condition, they can do. But number two is dietary factors. Dietary factors, dietary factors, inadequate breastfeeding or early weaning. All times, everywhere in this earth, inadequate breastfeeding and early weaning, it is very important. Early weaning means giving extra food within 6 months of age. A children is giving extra food, outside food, not other than breastfeeding. So sometimes parents they are thinking that if they give artificial food other than breastfeeding, so their kids will be very healthy. It is misconception, malpractices, and even we the physicians are not taking care about this kind of problems we are facing, but we are not telling to the mothers always. So never give any extra foods before 6 months of age. And generally, most of the parents they are giving extra food other than breastfeeding, which is very important for our community. And poor complementary feeding practices. Complementary feeding. So what kind of food, what quantity of food you should give to the children. We are not taking care about that. We are not learning, and we are not teaching also. And so many physicians they are not telling properly to the and sometimes due to illiteracy they are not understanding, and they don't try to understand also. They are not caring about our advice. So poor complementary and feeding practices is very plays an important role. And low protein and high carbohydrate diets, it is also very important factors. There are so many areas there where they are not taking sufficient quantity of protein. They only depend on carbohydrates. Sometimes it is they are thinking that if they are taking any kind of food, and if it is fulfill their hunger, then it is okay. And that kind of food we are taking, and people are thinking that we are satisfying our hunger, so I am healthy, I will be healthy, I may be healthy. So this is the misconceptions regarding this. Another important cause is infections and diseases. So many children are there due to providing outside food, improper food, artificial food. Children are mostly suffering from diarrhea, respiratory infections, measles, increased nutrient loss, and poor absorption. Frequent diarrhea causing if a children is giving regularly sufficient quantity of protein and sufficient quantity of food substances, that means balanced diet, but that child is suffering from frequent diarrhea. So if there is indigestion, so that children will suffer from malnutrition, as well as protein energy malnutrition will suffer. So they may suffer from this kind of problem. Respiratory infections is also important factors playing a great role behind it. Measles, during measles, so many people they are not giving protein to the children. But in case of in kind of eruptive fever, there is great loss of protein. So during measles, a patient kids suffering from measles, we should give maximum quantity of protein, but we are not giving that also. And increased nutrient loss and poor absorption if the child is suffering from poor absorption. So the body will not get proper quantity of food, though that kids are giving sufficient quantity of food. They will not. That will not help to that children. Infections and diseases is most important, plays a role behind protein energy malnutrition. Another important and last one is maternal health and low birth weight. Malnourished mother, maternal child health. There are so many clinics from government side is there. So many hospitals are there. So many NGOs are there who are providing maternal health services. But due to ignorance, illiteracy, people are not availing all these facilities, as well as if there is no proper maternal health care, So people will follow, children will suffer from low birth weight, and which is very important role. And child mortality rate due to low birth weight is high in India. Malnourished mother, underweight babies, inadequate antenatal care. All this plays a great important role behind it. Next is clinical features of protein energy malnutrition. We can discuss in three. That means marasmus and kwashiorkor in different way. If we follow some common features like symptoms. Symptoms of marasmus is severe wasting. Already I have told you. Prominent ribs. That means ribs bones will be prominent. Sunken eyes and alert but irritable demeanor. In case of marasmus. In case of kwashiorkor, distended abdomen, as well as there will be fatty liver, abdomen will be distended, abdomen will be large, think depigmentation and apathy. Skin depigmentation is very important. Color will be fed. Depigmentation, due to depigmentation and apathy. It is regarding symptoms. If we consider weight loss, in case of marasmus, there will be severe weight loss. And in case of kwashiorkor, mild to moderate. I have told you, marasmus is due to energy deficiency. And kwashiorkor is due to protein deficiency. So edema, in case of marasmus, edema will be absent. And in case of kwashiorkor, edema will be present. If we observe feet and legs, then we can see edema will be there. And muscle wasting, in case of marasmus, there will be severe muscle wasting, and in case of kwashiorkor, it will be moderate. If we consider skin and hair changes, in case of marasmus, sparse hair, dry skin, and in case of kwashiorkor, reddish hair, peeling skin will be there. And if we consider appetite, in case of marasmus, it will be good, and in case of kwashiorkor, it will be poor. Just I am presenting two pictures in case of marasmus and kwashiorkor. If you see, then in case of marasmatic patient, face looks like a prematurely old man. And impression of ribs can be seen, and emaciation will be there. Limbs like stick, no subcutaneous fat, edema nil. In case of marasmus. In case of kwashiorkor, there will be growth failure, apathy, irritability, apparently irritability, hair changes, anemia, muscle wasting, fatty liver, various atrophy of small intestine, depigmentation of skin, dermatosis, edema. It will be there in case of kwashiorkor. Just I am presenting through a picture. Next, how to diagnose the case of protein energy malnutrition. You know, anthropometric measurements and laboratory investigations both are the way to investigate, to diagnose the case of protein energy malnutrition. In case of weight, for height, wasting will be there. It will be moderate, severe, mid-upper circumference, that is more than 11.5 centimeters, severe acute malnutrition will be there, and 11.5 to 12.5 centimeter moderate acute malnutrition. If we go for laboratory investigation, in case of protein energy malnutrition, kwashiorkor, serum albumin low in kwashiorkor, electrolytes imbalance in severe cases, and hemoglobin anemia is very common. These are the way of investigation. Then, what are the national programs for protein energy malnutrition in India? Government is taking care regarding, Government of India is taking care of about protein energy malnutrition, as because it affects maximum percentage of children. So integrated child development services, that means ICDS. It is well known, and everywhere it is, government is providing this service with free of cost. Supplementary nutrition for children less than 6 years and pregnant women, they are providing sufficient supplementary nutrition regularly, and growth monitoring and preschool education. These are the two-way integrated national ICDS. Through ICDS, we are providing these two supplementary nutrition for children and growth monitoring and preschool children. And next important is midday meal scheme, a nutritional support for school children everywhere in our country. Primary school, even secondary school, they are providing through this midday meal scheme nutritional support for school children as their state, their sufficient quantity of protein and where protein mostly available, this kind of food the government is providing free of cost and improves school attendance and reduces dropouts. It is also very important. Not only midday meal scheme, not only targeting to supply sufficient nutritional support, but also another important objective is there to improve school attendance. So many people, so many children are there. Those who are working in the different sectors to get bread and butter. But if schools or government is supplying this, they will go to the school, not to their field work, as because they can get sufficient quantity of food at least at a single time in a day, and as well as school dropouts, it is reduced. It may reduce. So targeting these two important objective, nutritional support and to reduce school dropouts. So midday meal is very important and playing a good role nowadays. Next, Poshan Abhiyan, that means National Nutrition Mission, launched in 2018 to reduce stunting, wasting, anemia, focus on first 1,000 days of their life. We are targeting first 1,000 days of life. That means 3 years mostly. Poshan Abhiyan National Nutrition Mission, government is providing free of cost, and facility-based management of special nutrition rehabilitation centers for severe cases. If there is so many severe cases are there, so facility-based management, that means if rehabilitation, nutritional rehabilitation centers, in NRCS, this facility also available in our country, and we are government is providing free of cost to prevent protein energy malnutrition. So what about prevention strategies? Promoting breastfeeding and infant nutrition. It can plays a great role. Number 2 is maternal nutrition and education. Education is very important. I have told several times, education, illiteracy playing a great role towards protein energy malnutrition, and community-based growth monitoring. Number 4 is food security measures. Regarding promoting breastfeeding and infant nutrition, exclusive breastfeeding for 6 months, adequate complementary feeding from 6 months onwards. People thinking that exclusive breastfeeding means only to feed breastfeed, and outside, other than breast milk, other milk, that means artificial powder milk, it may be given. So it is not like that. Absolute exclusive breastfeeding doesn't mean that. Exclusive breastfeeding is only breastfeed. Even water should not be given to the children. So if we can promote this exclusive breastfeeding, surely we can reduce this problem. And adequate complementary feeding from 6 months on, that means from weaning period. Adequate complementary feeding from 6 months, that means protein, fat, carbohydrate, that means outside food, natural food, which if we can provide to the kids, then we can reduce protein energy malnutrition. Next, maternal nutrition and education. Ensure proper antenatal care, provide iron, folic acid, and calcium to pregnant mothers. Next, community-based growth monitoring, Anganwadi centers, ASHA workers, taking child growth. You know, Anganwadi workers, ASHA workers, they are visiting door to door to find out regarding protein energy malnutrition, who are the children, those who are suffering from protein energy malnutrition, what to do, and they must inform to the primary health center, and medical officer will think about, he will send the information to the higher authority, and they will send feedback. And these are the way we can manage our protein energy malnutrition. Next is public security measures. That means public distribution system, providing subsidized food grains, fortification of food with essential micronutrients. You know, their food distribution is very important, and food distribution is very difficult to distribute properly, as because some peoples they are getting food and misusing that food also, and some portions of people they are not getting a single times food for their life. So this is very important, and fortification of food is very important. There are so many micronutrients there before packaging or before that means like milk fortification. After heating of milk, so many nutritious substances it is lost due to only heat. And during packaging, some like vitamin A, vitamin A is adding to the with the milk before packaging, and that milk is mostly consumed with children. So that food fortification is important, and so many misconceptions are there regarding fortification. So fortification, fortified food we should provide like salt, fortified with iodine to prevent iodine deficiency. So fortification, if we can provide fortified food in proper way, so we can reduce protein energy malnutrition. Now, recent updates on research. WHO Global Action Plan on Child Wasting 2023 focus on early detection and community-based care. It is very important. Question in India, strengthening early childhood nutrition interventions and introduction of ready-to-use therapeutic foods. That means for severe cases in India, we must supply therapeutic foods. Therapeutic foods means with medicine or with fortified food or specific food which requires in sufficient quantity. We can provide. So this is very important for protein energy malnutrition. Next conclusion. Protein energy is a major public health issues requiring multi-sectoral interventions. Early diagnosis, treatment, and community-based strategies are essential. Prevention through maternal and child health care is the best approach. These are the conclusive for protein energy malnutrition. It is a major public issue, we know, requiring multi-sectoral interventions, especially from government side. So many opportunities are there. Government is also doing that, but it is not still now not sufficient. So this is why so many children are suffering from this kind of problem. Early diagnosis is very important, and everywhere diagnostic system free of cost, as because it is mostly people, those who are not living well. That means suffering from poverty, not financially able to supply their food to their kids. So early diagnosis is very important, and if we can treat that kids, and if we can accept community-based strategies are essential, so that we can reduce protein energy malnutrition, and prevention through maternal and child health care is the best approach. We can reduce this problem. Now, as a homeopath, we must say some homeopathic medicine through which we can manage. And before prescribing any homeopathic medicine, I must say, don't go for a specific medicine for a specific patient, not like that. We have no specific medicine. Before that, we have to consider symptom severity. We have to take a case. We have to consider individualization and what are the problem. So many patients, those who are living below poverty level, only they will not suffer from protein energy malnutrition. Already I have told you those who are malnutrition, suffering from malnutrition, not getting proper quantity of food, proper quantity of protein, proper quantity of energy. They may also suffer from, some kids, those who are suffering from frequent infectious disease, frequent diarrhea. So they also may suffer from protein energy malnutrition. It is not only due to insufficient supply of protein or energy giving food substances. So there are so many scopes we have. As a homeopath, merovinum is a very good medicine. One of the many cases of remedies is in the inherited complaints of children. The infant soon emaciates and becomes melasmatic, and that an inherited psychosis from a parent. Children of a psychotic father are especially subject to attacks of vomiting and diarrhea and emaciation. They resist well-selected chronic remedies and are only palliated by well-selected remedies. After merovinum, they thrive and remedies act better. Merovinum is a very good medicine as it is a psychotic remedy. Iodium is very important. Rapid metabolism, loss of place, great appetite, hungry, with much thirst, great weakness, and slightest effort induces aspiration, loss of place, yet hungry and eating well, liver and spleen sore and enlarged, pain in the eyes, island lacrimation. Like this, we can prescribe iodium also. Isosinopium is a very good medicine. Restless, anxious, carrying inability to think, to fix the attention. Idiocy may alternate with fear and irritability, photophobia, rolling of eyes and falling asleep, dry mouth, pustules in throat, intolerance of milk, undigested thin, greenish stool, preceded by colic with teresmus, followed by exhaustion and drowsiness, cholera infantum, child cold, clammy, stupid, with the staring eyes and dilated pupils, weakness of lower extremities, fingers and thumb, clenched. Child is so exhausted it falls asleep at once. Anasarca, if we see these symptoms, we can think about it as a synopium. Calcutta is also very good medicine. Anemic children who are previous flabby have cold extremities and feeble digestions, forgetfulness, great hunger with thirst, easy vomiting in children, involuntary sighing, sunken and flabby abdomen, unable to support head. We can prescribe Calcutta first, Calcutta carb, impaired nutrition, children who grow fat, are large bellied with a large head, pale skin, chalky look, children scrapes eggs, eat dirt, and with other indigestible things, are prone to diarrhea, forgetful, confused, low-spirited, sensitive to light, lacrimation in open air, and early in the morning, eyes fatigue easily, spots and ulcers of the cornea, distension of abdomen with hardness. Children are late in learning to walk. Children's nettle rash of skin, very important medicine for protein energy malnutrition. You know, abrotenum, it is well-known good medicine. Marasmus, especially of the lower extremities, despite a good appetite, emaciation progresses, occurring in weak children who are emaciated, wrinkled, pale, blue rings, round, dull-looking eyes, groin, hunger, with winning and bloated abdomen, cross, irritable, anxious, depressed. We can think about abrotenum. Silesia is very good medicine. Imperfect assimilations is very important. I have told several times imperfect assimilations and consequent defective nutrition, scrofulous, rachitic children with a head open, frontal and sutures, distended abdomen, slow in walking, lack of vital heat, photophobia, eruptions on chin, hard bloated abdomen, yellow hands and blue nails, much alarm in bowels, loss of power in legs, phelons, abscess, boils, eruption, easy only during daytime and evening. We can think about silesia. Natam is also very good medicine. Dropsy, edema, anemia, great debility, maximum weakness is felt in the morning, in bed, emaciation, most notable on neck, great weakness and weariness, dry mucous membrane, irritable, gets into passion about travels, awkward, hasty, hungry, yet loose flesh, unquenchable thirst, sweats while eating, craves for salt, distended abdomen, even and a dry eruption on skin, eczema, raw, red and inflamed. Alnus rubra is very good medicine. It works well on swollen glands, gastrointestinal issues, and other conditions because it promotes nourishment, damaged throat and mouth mucous membranes. Oleum jacoris aceli, internal nutrition combined with a pancreatic and hepatic treatment, scrofulous illness, rheumatic symptoms, lassitude and emaciation, infant atrophy, emaciation with hot hands and a fever, nocturnal restless and fever, discomfort in the liver area, tuberculosis at the start. Alfalfa is very good medicine due to its sympathetic actions. Lucerne has a positive effective on nutrition. This is demonstrated by toning up the appetite and digestion, with leads of a significant increase in both physical and mental vigor, as well as weight gain. Malnutrition related disorders such as neurasthenia, splenic blues, nervousness, sleeplessness, nervous indigestion, etc., are most treated by it. Produce fat and eliminates tissue waste, inadequate nursing, lacanum, weak sinking sensations in the pit of my stomach when I get up in the morning, burning in the area around the stomach, as well as weight and stone-like pressure, severe nausea with lightheadedness in the stomach, weakness in strength and appetite, distaste for meals, particularly fried or fatty foods. Lycopodium is also very good medicine. Pinia sylvanensis, very good medicine. Thank you. Hello. Prachi.
So yes. So thank you very much for this knowledgeable session. I would like to request the participants, if they have any doubts, they can ask. So if participant is having any doubt or have questions to ask, they can ask freely. No, then I would like to conclude at. Hello, am I audible, sir?
Yes, yes, yes.
Okay, so I would like to conclude our today's session by expressing my sincere gratitude to Dr. Anup Das, sir. Sir, thank you very much for sharing your valuable insights on today's session. We truly appreciate your participation for tonight's webinar. Also, a big thank you for the participants for engaging in tonight's webinar. And lastly, to the entire organizing committee for ensuring that the entire session ran smoothly. A gentle reminder, the video recording of today's webinar will be available on YouTube channel of Homeopathy 360. If you want, you can check it out on it later on.